Good morning. Welcome to our 10th Movement is Life Caucus. Woo! Dr. Martin Luther King Jr. said, "Of all forms of inequality, injustice in healthcare is the most shocking and most inhumane." 50 years later, injustice in healthcare still prevails. We're here to discuss this very complex problem and to find solutions. And in order to do so, we need to see with our eyes and feel with our hearts, because these are real patients and real families and real communities who are suffering. So I want to start with how well we see. I'm going to give 3 statements and ask you to respond true or false after each one. Okay? Okay. True or false? Your zip code is a strong predictor of your life expectancy. True. Correct. Women receive less health care than men. Women and individuals of color are far more likely to suffer from chronic medical conditions. Okay. You all see very well. But I also think it's important that we feel these disparities, because these aren't sad disparities. They're not unfortunate. They're outrageous. And I guarantee that you will be outraged by what you learn in our sessions today and tomorrow. And I believe it will compel you to become an even stronger voice in your communities, because we can't afford to keep this information and solutions to ourselves. Now let's look more closely at zip codes and life expectancy. People are dying before their time in all parts of this country in both rural and urban settings. And when we look at Chicago, we can see that the life expectancy in the Gold Coast, which is the affluent part of downtown Chicago, is 85 years. But if you go a little south, into Washington Park, it's 69 years. And if you go out east on the Green Line, it's 72 years. This is strange, such 16 years of difference between where you live. Well, these zip code influences on life expectancy aren't isolated to our cities. Here's Kentucky. Let's look at Perry County, where the average life expectancy is 70.6 years. And that is less than the state as a whole, of 75.8 years, and you can see that's even less than the United States. So sometimes when I see these troubling statistics, I think, you know, that's someone else. That's not me. That's not where I live. So, you know, I decided to look at where I live. You can all see my house? Okay, so that's my house in a neighborhood called Westville in New Haven, Connecticut, which is just near the Yale Bowl, for those of you that are familiar with it. And the average life expectancy in my zip code is 83 years. And then I said, well, what about where I see patients at the Yale Orthopaedic Clinic? Let's look at that. There it is, 73 years. That's 10 years difference. And that distance is 2.8 miles. 2.8 miles means you live 10 years less. If this is my backyard, I think this is going to be your backyard too. And I think this is a problem that we all share. And again, this isn't something that's sad, and it's not unfortunate. This is outrageous that 2.8 miles means you're going to live 10 years less. And I also want us to recognize, you know, that we're not just talking about people dying before their time. We're talking about people suffering while they live. So we need to pause for a moment and say, how did this happen? How did we get to this state where zip codes predict life expectancy? We at Movement is Life have been studying this complex problem for 10 years. We created our Movement is Life vicious cycle model to help us understand the complex interplay of forces that create these disparities. Some of you may be familiar with our model, and I'm going to share some new information about Operation Change later on. But for right now, we're going to start with what we call the medical vicious cycle. And in this, you can see if you start at the top, that if you have joint pain, that leads to limited mobility. That limited mobility causes you to be less physically active. And then you gain weight because you're still eating the same, and that weight puts more pressure on your joint, which then causes more joint pain. And so you can see, you get into this cycle that results in painful, limiting arthritis. But that's not the full story, because that lack of physical activity and obesity also causes you to develop chronic, life-threatening conditions of heart disease, diabetes, hypertension, depression. Now, another interesting thing about the medical vicious cycle, it's an equal opportunity employer. The white, affluent male CEO can get trapped in this cycle, just like the low-income woman of color. But women and individuals of color are so much more likely to get trapped in this cycle. Why is that? Because around the medical vicious cycle is this green ring of social determinants of health. And these social determinants of health impact women and individuals of color so much more than the Caucasian male. So today, I want to take just two of these social determinants and do a deeper dive. Let's talk a little more about access and literacy and education, which is basically our ability to make healthy choices. The Affordable Care Act gave millions of Americans expanded insurance coverage through Medicaid. But what we know is that insurance doesn't always mean access. I want to share with you some recent research we just published. Dr. Dan Whitney is a senior author, and he's a member of our steering committee, and I saw Dan is here someplace. Dan, stand up, please. And Dr. Saeed Ibrahim is also a co-author. Many of you know Saeed as well. Stand up. Thank you. Okay. So Dan researched the 29 urgent care centers in the state of Connecticut. And these are urgent care centers where people with orthopedic and bone and joint musculoskeletal problems can go for care. And of these 29 centers, 19 refused to see any patient with Medicaid. So if you received insurance through the Affordable Care Act, you cannot be seen in 19 of these urgent care centers. 4 of these centers, as shown in green, accept patients regardless of their insurance status. Kudos to them, okay? And the remaining 6, they'll see a Medicaid patient one time, or maybe they'll see you if you're from their very, very local community. All right, so you say, all right, this isn't great, but you know, this person with Medicaid, they could go to the hospital emergency room and be seen. And after all, hospitalists have specialists, and they've got fancy X-ray equipment with CTs and MRIs, so maybe that's not so bad. But what if your hospital closed? Or what if the closest emergency room is miles and miles away? 155 rural hospitals have closed since 2005. Hospitals are closing at record rates and in locations where they're needed the most. 46% of rural hospitals are operating at a financial loss. That makes about 700 more hospitals at risk of closure. You know, and it's not just hospitals in urban America, in rural America that are closing. We're seeing closures of hospitals in our inner cities. This is Hahnemann University Hospital in Philadelphia, one of the largest cities in the country. Hahnemann was the safety net hospital for Philadelphia. Hahnemann was purchased by a for-profit company, and that company said, we can't keep losing millions of dollars every month. So they closed the hospital. This isn't sad. This isn't unfortunate. This is honestly outrageous. I don't know where the people of Philadelphia that depended on this hospital are going to go for their care. I want to read to you a quote from Dr. Kevin DeMello, who's a physician at Hahnemann, and he wrote this fabulous op-ed piece, and I just want to share a portion of it with you. These events have shaken my faith in what had been a firm ideal for me. The public good of a safety net hospital was so essential to our society that it must be maintained at any cost. Safety net hospitals play an important role in maintaining the health and safety of the public, just as police and fire departments do. The public good cannot be truly driven by a profit motive. Dr. DeMello went on to close his comment by saying, "It's difficult to look at myself in the mirror without feeling that I have failed my patients and my trainees." Wow. Demoralized doctors, demoralized nurses, another high cost of hospital closures. And it's not just access to urgent care centers or hospitals that's creating disparities. It's also limited access to patients being seen by doctors in doctors' offices. I want to introduce you to Mary. Mary's this wonderful woman that I met in Hazard, Kentucky when I was in Kentucky a couple months ago. She's 85, she lives by herself, and she's a brittle diabetic. That means that her body doesn't use insulin like normal people do, and she needs a specialist, an endocrinologist, to help her manage her diabetes and to keep her alive. Mary has Kentucky Medicaid insurance. With the help of her community health care workers, she was able to find an endocrinologist. But where was that endocrinologist? There weren't any endocrinologists in Hazard, Kentucky. There wasn't anybody even in her whole county. She had to go to Lexington, over 2 hours drive away, to find an endocrinologist. But what could she do? So she would go to Lexington. Fortunately, this doctor was fabulous, really cared about Mary. She credits him with saving her life. One day, she goes to see her doctor, and he says, "I'm sorry, they won't let me see you anymore." Let's listen.
He said, that doctor said, if I could take you, I'd take you for nothing and treat you. But he couldn't because he belonged to that group, and they wouldn't accept WellCare that he belonged to.
And I said to Mary, "How did that make you feel?"
I wasn't worth taking care of. I felt nobody cared.
She said, "I felt like I wasn't worth taking care of." Did everybody hear that? Let's say that together. I felt like I wasn't worth taking care of. Now, that's not how we want patients to feel getting health care in this country. That's not how we wanted the doctor who was taking care of her to feel, that he can't keep taking care of his patient. And this isn't sad or unfortunate. This is outrageous, outrageous. Now, the common thread that we see surrounding hospital closures and urgent care centers not taking some patients, and doctors' offices saying, "I can't see you anymore because you don't have insurance I accept," is the way we pay providers. We at Movement is Life have been focused on payment policies for some time. And you can see now what we call our expanded vicious cycle, where there's a blue ring that surrounds the green ring of social determinants, and that blue ring is public and private policy. Because it was the private policy of the doctors group that told Mary's doctor that he couldn't keep taking care of her, even though he would have done it for free. It's public payment policies that are impacting closures of hospitals because of the payment models. We have had the honor of working with Congressman John Lewis. John Lewis has introduced the Equality in Medicare and Medicaid Treatment Act. And this is very important legislation because it requires the Center for Medicare and Medicaid Innovation to assess the impact of any new proposed payment models on both access to care and on disparities. And yesterday we were actually up on the Hill doing a briefing, which was very well received, and so we're right there supporting Congressman Lewis and his leadership on this very important effort. Now we're going to turn to the other factor of that social determinants of health, and that is literacy and education, meaning our ability to embrace healthy lifestyles and make good decisions. And in order to do that, if we're going to be healthy, we need three things. We need education, we need infrastructure, and we need motivation. Let's start with education. I learned a lot about education from this woman, Maria. She shared a story with me how she learned to cook healthier meals. And so she went home and she started making one healthy dish in the evening family meal, and she would be eating it. And then the children started to eat it too. But her husband, well, you know what I'm going to say. He didn't want to have anything to do with it, right? But even he started to eat the healthier food. And I remember thinking, Maria is the pebble in the pond. One mother having this powerful ripple effect. She learned how to cook healthier dishes, and she's improving not just her health, but that of her entire family. Now, you can't cook healthy meals if you don't have healthy food. So the infrastructure of how we shop and get food is very important. This is a picture of a convenience store in Butcher Holler, Kentucky. And when I was in Kentucky, I learned that for the people that live in the holler, meaning up in the hills, they typically will come into town once a month to grocery shop. And the rest of the time, they're shopping in these little convenience stores. These convenience stores do not carry much in the way of fresh fruit and vegetables. And if they do, they're expensive. So if you're on a fixed income, you don't buy this expensive, healthy fruit and vegetables, which probably isn't all that fresh. And so if you don't have the ability to have healthy food in your diet, then you can't have a healthy diet. Now, what about the infrastructure that's required for us to be active, physically active, and move? Here's the picture of an actual inner city neighborhood where families live in these buildings. And if you live in a place like this, you know it's not safe to be outside. And so you don't go outside, and you don't send your children outside. You stay inside, sitting and being inactive. These are 6 of the 13 children who were killed by gun violence last summer in St. Louis. They were outside their homes. They were playing on the porch with their siblings. They were killed by stray bullets. If it's not safe for you to be outside, you stay inside, and you keep your children inside, and you start to get trapped in the vicious cycle because you are sedentary. And again, this isn't sad, and it's not unfortunate. This situation is outrageous. The third element that we need for a healthy lifestyle is to be motivated. The lack of motivation is the #1 killer of success. So we have recognized how important motivation is in our Operation Change program and have incorporated that. Operation Change is an 18-week community-based program for women. We've had programs in both urban and rural America, and it's just achieving wonderful things. Each session is a 3-hour session, 1 hour on education, 1 hour on movement, could be dancing or Zumba, okay? And then the 3rd hour on motivational interviewing to help these women understand what their barriers are and to find their motivation that's going to allow them to overcome these challenges. We've sponsored 6 programs to date, and I'm going to share some data on knee pain reduction. I think you'll find it's amazing. Here we go. So we asked Operation Change women how much pain they had at the beginning, and you can see at baseline the levels of moderate, severe, and extreme pain, and then after 18 weeks, look at that improvement in knee pain. And this is without drugs or surgery or injections or therapy. This reduction in knee pain is because these women started moving. I'm going to share this clip with you from Maria, one of our Operation Change Chicago participants. She starts speaking with, "We started walking."
We start walking, just walking. Then we start doing exercising, we start dancing, we do Zumba, we do kickbox. The result has been that my pain has getting better, like 85%, I can tell. Now I can do too many things that I can do before.
We've also seen significant improvement in the mental outlook of our Operation Change women. Much less feeling of hopelessness and despair, much more positive in terms of their outlook. Again, without drugs or therapy. Operation Change empowers women to support each other and to seek and use their voice to take control of themselves and impact their communities. I want to share one more clip from one of our Operation Change women.
It's a lifesaver. It's a lifesaver in so many ways where you can change your whole body. I was taking high blood pressure medicine, cholesterol, Zoloft, aspirin for my heart ailments. And as the time went by, I'll give it about 3 or 4 months in, everything changed. My doctor took me off the Zoloft. He took me off the high blood pressure medication, and I was thriving. I was a completely different woman after that, and I lost 14 pounds. So I was very happy, and I'm still happy.
So powerful. We are making a difference, and with your help, we can do even more. We talked this morning about access to care and embracing healthy lifestyles. And we know that we also need high-quality care that is given to us regardless of our race, gender, ethnicity, or insurance status. And when these 3 factors all intersect and come together, we have health equity. So let's think of all these factors in our discussions as we find solutions for the challenges that we're facing. As we kick off this caucus, I want to remind each of us that we can make a difference. You don't have to be big to be powerful. Movement is Life has proven that. We're a grassroots organization. But to be successful, you need to be committed to a vision. Are you committed to our vision? What more can you and your organizations do to support it? I want to thank you for bringing your minds and your hearts to our discussion the next 2 days. Let's use our collective wisdom to chart new directions forward. Thank you very much.